there. My name is Dr. Kimberly Ernest, and we are here with the How to Be Happy Hour. Today, we're going to be talking about vicarious resiliency within the mental health field and how we as a helping profession can seek to heal the endemic stress and burnout that we're seeing within the mental health, substance use, and community mental health service areas.
Hi, I'm Kristen Wortluft. I am a certified advanced alcohol and drug counselor, certified family recovery specialist, and certified recovery specialist supervisor, and outpatient therapist at York Psych and Allison Hill. And I've been doing that for almost 6 years.
I'm Tiffany Ramos. I'm a certified family-based clinician in Lebanon County, also a mentor in Lebanon County for other family-based clinicians, and I'm about to reach my 10-year anniversary.
I'm Elise Nichols. I am the Dauphin Lancaster Lebanon MST Director, Multisystemic Therapy, Dauphin County Family Reintegration Program Supervisor, and Dauphin County Intensive Behavioral Health Services Administrator. That's a mouthful. And I've been a PCS for almost 15 years in various capacities. So, yeah.
Awesome. I'm Crystal Porter. I am a licensed clinical social worker, clinical co-director for outpatient services at PCS, where I've been about 13 years, and in the field a little over 20 years.
So even like in our introductions, it's clear that everybody around this table wears a multitude of different hats. Everyone around this table has a duration within the industry that suggests that y'all have probably found a few ways to survive a really difficult workplace environment. And so today I'm going to do things a little bit differently. I don't usually lead with like a teachy part, but I recognize that not everybody listens to this podcast linearly. And so in the last podcast, I talked a lot about stress, burnout, and moral injury. But today I want to dive into the flip side of that. But first, feel like it's important for me to go through a few definitions and a few signs and symptoms so that everyone can feel like they're on the same page moving forward. And should somebody not have the time or ability to go back and listen to the last one, I want to make sure everybody's coming into this space with a shared understanding. So just before we launch into that, I want to start out by talking about this concept of vicarious trauma and the idea that vicarious trauma is also sometimes called secondary trauma or can be referred to as compassion fatigue. And it's the emotional, cognitive, and sometimes physical impact of repeated exposure to others' traumatic experiences. We see this a lot within the mental health field, a lot of the other helping professions. We can see it within law enforcement or physical health. In the last podcast, we had somebody as an emergency room nurse, and she talked about her experiences there. Some of the signs and symptoms of vicarious trauma can include, but are not limited to, flashbacks and intrusive thoughts about clients' traumatic experiences, feeling emotionally numb or detached from the stories that our clients tell, feelings of helplessness, anxiety or depression, irritability or mood swings, changes in sleep pattern or appetite, feeling overly tired or sleeping too much, difficulty concentrating and making decisions, and even hypervigilance or heightened emotional arousal responses. Now, vicarious trauma, when it is present for an extended period of time and the clinician or individual is unable to kind of process and navigate that well, it can lead to this experience of burnout. And burnout would be best defined as emotional, mental, and physical exhaustion caused by chronic work-related stress. And these symptoms may include feeling emotionally drained and depleted, a reduced sense of accomplishment or efficacy within one's work, increased cynicism or detachment from clients or colleagues, persistent feelings of irritability and frustration, decreased motivation or engagement, physical symptoms such as headaches, fatigue, or muscle discomfort, and difficulty sleeping or otherwise disrupted sleep patterns. We talk a lot about stress, burnout, vicarious trauma, compassion fatigue, but I also feel like there's something that I'd like to start to introduce into that conversation, which is this concept of moral injury. And the notion of moral injury it's not a new term, but it's fairly new in its application to our present field. Moral injury specifically sort of emerged in the 70s when we had veterans returning from the Vietnam era, the Vietnam theater of war. And moral injury occurs when professionals experience psychological distress as a result of actions, decisions, or inaction that conflict with their deeply held values and ethics. And I feel like that is particularly salient when we are talking about community mental health right now, because there are a lot of gaps within our service region. And so often we are met with a client that we don't have the resources to serve them, or perhaps we don't have the resources to serve them fully, and repeated exposure of that, I hypothesize is resulting in moral injury. And I also would hypothesize that we are oftentimes mischaracterizing moral injury as burnout. So we're calling it burnout, but I don't know. And I think one of my big hypotheses, and we talked about this a lot the last time, is that about 10% of our work, so 10% of our caseload, 10% of our supervisees, 10% of our advocacy or responsibility at work is contributing to like 90% of our stress. And I think it's in that place where moral injury emerges, or at least that's what I've noticed within myself. Some symptoms of moral injury, just to make sure we're all on the same page, are intense feelings of guilt, shame, or regret, rumination surrounding a client's experience, loss of trust in oneself, one's professional abilities, or even one's profession or colleagues, cognitive dissonance regarding ethical choices, emotional distress and inner turmoil, questioning the purpose or value in one's work, and increasing feelings of isolation and alienation from one's colleagues. It's really important to note that these are not three different finite experiences, but rather ones that overlap and intertwine, and they lead to a fairly complicated web of psychological challenges that I think we're really seeing play out within our mental health professionals working specifically in a community-based setting. But I also think it's really important that we as providers and professionals and supervisors and mentors remain vigilant when we see it, because I also know, let's just put it this way, anytime I'm met with a colleague or a supervisee in which I have to have a very difficult personnel discussion, one or more of these factors is almost always present. And so I know that stress and burnout often hurt the provider. Stress, burnout, and moral injury hurt the provider. But I would argue it also hurts the system. And I think in the end it hurts our clients. And so my fear is that we frequently kind of like sacrifice ourselves on the altar, thinking that what we're doing is like kind of giving to that space. But my fear is that we're blind to kind of the downsides of continuing to function when we're not operating from that place. So those are my big concepts that I wanted to introduce to the space, because I feel like it's important for us to have a shared language. But I also invited each of you specifically because while I imagine you probably have each had experiences with that which I've described, you've all each found a way to navigate those experiences with grace. So I just want to open it up, and where do we go from here? What do you all see as our opportunities as community mental health providers to heal our field whilst continuing to serve our clients and communities?
Well, I guess I'll go. I actually just had a conversation with the staff today about vicarious trauma and how clients have been impacting their ability to do their job. And, is this the right field for them? Should they find something else to do? And my first thing was to normalize it and say, it's okay. We've all been there. I had a meltdown earlier this week just because, everything's hitting and you feel like, oh my gosh, I don't have time to do this. I'm failing my staff and then the clients, and it just, snowballs. So it's okay to acknowledge the crappy, but also what can we do to help that? So maybe it isn't the right field for you. Maybe that's not the right clientele for you. Maybe we need to help you find a better fit. So, the discussion of that, but also what can I do as a supervisor and what can our staff do as a community to come and say, what do you need and how can we support that? And I asked her that. She literally looked at me and she goes, that's a great question that I don't know the answer to. And I think that's the problem, is I'm very willing to acknowledge with my staff, we all struggle. And I think the best of us in this field have our own struggles, and we learn from that. We use that. And so I think that's a great strength, but we're also the ones that tend to overlook ourselves. And so we're very good at helping our clients find out, what can you do? But we don't even know how to do that for ourselves. So I think helping staff realize, like, how can we help each other? Is it we need to go have a trivia night somewhere and have a few drinks, or, you know, just go play mini golf, go to a rage room, something that's helpful, or do we just need to sit here and cry together? So I think that's what I've encountered, especially today, actually, as a big problem, is I want to help. I'm willing to do whatever it is we can to do to help, outside of the box even. But I think sometimes our helpers don't know what they need for help. And that's the barrier I'm encountering, is we're acknowledging it. We're very good at saying, at least my people, I think we've cultivated that culture. I think PCS as a whole has cultivated that culture, that it's okay to say, I'm struggling, I need help. But we don't know what that help is. So I don't know that that's helpful.
I think it is. But, because from where I sit, we've now, I mean, we've named one of our biggest challenges. And like, I know some things that would like, if we had higher reimbursement rates and therefore our therapists made more money, therefore they needed to have less billables to meet their financial goals. Yeah, absolutely. That would be phenomenal. Managed care companies, if you're listening to this, that would be a great solution to the endemic stress and burnout that we're seeing within our field. But like, that's one of the many pieces to the puzzle. And I think what we've also noticed is within the last couple of years, PCS has increased because we have gotten some rate increases, and we've immediately turned that around and put that right back into other, we've put that right back into the rate that we pay our clinicians. And I think on a lot of ways that's been really helpful. And it's helpful in recruitment and hiring, but I don't know that that's helpful in the stress and burnout conversation. I think we can pretend it's helpful, but I don't know that that's going to hit the mark.
Yeah, I think for me and a lot of my staff, it's the relationships that we cultivate, and that we have that open, honest, like, we can sit in the crappy with each other, and that's okay. And it's not just, let's come up with a solution. I mean, we will come up with a solution, and if that's, listen, you need to take a mental health day for yourself, you take a mental health day. Because there's inherent things from our setting that we can't change. I can't change our high-risk clients, you know? I wish I could, but if we did, we wouldn't have a job. You know, I can't change that. I can't change the reimbursement rates, which for my programs in the past few years, I would say, knock on wood, we've had an increase every year. So, like, compared to 15 years ago, we're doing great. But I also understand for today's economy, it's not that great. But I think it's the relationships that we cultivate, and having the open and honest conversations and having the more family atmosphere is something I think is almost invaluable and more important. I don't know, maybe not important, because we need the money. Let's not be real.
Yes, managed care companies. If you're listening to this, we still need the money.
Yeah, no, we definitely, yes, we do. But I think we definitely need those relationships, because if you don't have the other things, it's those relationships that keep you going.
That was one of the things that when I heard about this topic came to my mind. Like, a few things did, but the relationship part, in family base, you have a teammate. So I am out on the field with another co-therapist most of the time. And I see that even like police officers do that, some EMT personnel do that. And I really think that's what's kept me here for a really long time, just because if I'm having a sucky day, my co-therapist will bring the heat more, and we kind of balance each other out. If she's like, oh, I'm feeling this, I'm like, I got you today. And when we're both bad, we laugh about it, maybe shed some tears in the car, and then we go to the next client and we're refreshed. And not every day is the same for us either in my work that I do either. So I think that also helps. But the relationships I think are so important. But the problem is too, like when you first start a field like this and you're still developing those relationships within the office, you don't get to see where we're at now, like on the other side of things, where I have a great relationship with my supervisors. I can go into supervision and just cry if I need to. I can just be blunt about like yesterday sucked, like, or whatever I need to, if I need to curse, I need to say whatever. But the beauty of it is being here long enough to embrace, like to see that and feel it and experience it. So it's hard for me even as a mentor when I mentor new staff because they're just getting in the field and they're just getting into our office. And I'm like, it's a great office, great people, but they just have to go off my word. They don't experience it yet. But like, that is one of the main things that keep me here, the relationships that I have in the office that keep me going. And I feel very comfortable. But like I'm the vet in my office. Of course I am. You know what I mean? So I feel comfortable coming in and just laying it out. But I feel like it's super helpful for me, and I've stayed here for a long time because of that. So that was one of the main things that came to my mind, the relationship, especially with my co-therapist. I've been blessed with 3 really good co-therapists in the last 10 years, and we've just vibed automatically. One of them is like one of my best friends still till this day. So they're all going to my baby shower tomorrow. Like they're all like, they're all integrated into my life somehow, but the relationships are just so important, I think. But new people aren't going to really experience that quite yet.
So yeah, I do developmental supervision with all the new therapists.
Yes.
And so that is something I preach heavily. It's like, yeah, you might be able to go make more money at Sheets, managed care, but you will never find the relationships that you find here at PCS. And that was definitely one of the first things that came into my mind when I thought about this topic, because I have gone through some of the hardest some of the hardest times of my life while working at PCS. And if it wasn't for my supervisors, my coworkers, my teammates, I would not have been able to survive as a clinician, continue to excel in my career, be there for my clients. Like, they were fundamental in my ability to heal through that and continue my work in this field. And that's just, I've worked plenty of places in my life, and that's something I've never experienced. And I think that is priceless. And so I really try to let the new therapists that are like fresh out of startup freaking out about all the paperwork, I'm like, you can come and sit down and you can just be authentically yourself with me, and I'm going to walk through this with you, because life outside of here is hard. Like, we all went through the last 3 years of pre-COVID, post-COVID, all of that. We're all like working on our educations, and we all have got stuff going on at home, and groceries are expensive. But, and we all want to help our clients. And so how can we do that together authentically? And I think that's been something that's so important to help those people walking in the door, because they don't know yet. They don't know what we know. They don't
How do we create that though? Because so I have advanced degrees, obviously. Like, I have my bachelor's, my master's, my doctorate, and so I spent 10 years of my life trying to prove to the next phase that I'm good enough, and like, take a chance on me. Like, when I went for my master's, I got a master's because I was denied by all my doctoral programs. And so, and I think that's not an uncommon experience for a lot of our clinicians. I think still the educational system, there's a lot of competition and less camaraderie than can be helpful. And I can think about, like, my greatest point of burnout probably wasn't even in the field, but over the course of my master's degree, where there was so much competition, like within your cohort, and competition for grants and positions and TAs, and then competitions for the 5 doctoral slots and the 15 master's students. And so, you work so hard to like be enough and project enough and to be fine. And like, I'm totally emotionally regulated all the time. And like, you have to put up this really good front. And then you get to like a place like like PCS, and I don't think PCS is super, like, I like to think we're special, but I don't know that we're so unique. I think there's a lot of great work environments out there doing the hard work and trying to cultivate that environment. But so often I get that bright green clinician with like their newly minted bachelor's or master's degree, and like I can see the tears like streaming down their face, and I'm like, hey, tell me what's up. Like, give some of that to me. And they're like, I'm fine. What are you talking about? It's allergies.
Allergies.
Allergies,
It
yeah.
really is, I promise.
Yeah. Yeah, I think you say, I see the tear. I think that's a part of it, is inviting them to know we cry here, we curse here
we do.
sometimes. We, and I think we lead by example is really, I often think people listen to maybe half of what I say is probably a good, it's not a good day.
I think that's really
Is that
optimistic.
really optimistic?
I'm thinking like 10%.
As a supervisor, thinking 50% of what you say
20%,
sticks. I like it.
Is anyone listening? Yeah, so, but they watch everything I do. And so, I think humility is such a big part of it. And 20 years ago, I made a ton of mistakes. And today, I made a couple of mistakes, So I think just creating that culture where you can say it 100 times, but they have to feel that, when you're sitting in a treatment team and you have a seasoned therapist saying, I need help with this situation that I'm in, or I don't know that I handled this the best way. What do you all think? I think are ways that you just really intentionally continue to create that culture, because we can say it all day long. But to your point, I think, it's like, I need an A+, right? How do I get an A+ here? Well, there isn't an A+ in when you're working with human beings. And so, yeah, I think sharing a lot of examples. I've had mentors and supervisors who have guided me in that way and said, here is something I really messed up, and here is what I took away from it. So trying to do that and sharing stories with people around, I made the same decision and wound up in this kind of a bind. Let me tell you a story about it. And I think that resonates with people too, right? Because data, content, all this stuff that's getting thrown at folks, and outcome measures and, screening tools and all of the documentation. So I think people really connect with stories. I really connect with stories, and that's what I remember, and helps to just really reinforce that it's okay not to be perfect here. Tell me about the tears, or tell me about the tears when you're ready, right? Week 1 of a new job, you might not be ready to tell me what the tears about, but I'm here for it when you are, So I think encouraging them to share that part, the woundedness that you were talking about, and also being patient with their process for doing that.
I love that humility piece. I feel like humor also goes with that, and that's like one of my superpowers, and that's when I use humor all the time, whether it's in therapy or mentoring. But through that, I get to share some of the experiences that I cried about at the moment, but now I can sit here and crack up. It was not funny at the time, but I'm able to share those stories, and I really feel like stories connect people. It really does. So I just wanted to back that up. Yeah.
Yeah, and how many times are the stories, like, in hindsight, hilarious?
Yeah, hilarious.
Hilarious. Like,
Absolutely.
what are the odds that this, like, sequence of events would happen to put us in the space? And it's not, it's never funny at the time. And it would be weird if you were laughing, right? And God, I mean, how do you do this job without a sense of humor? And I've received criticism for it. Like, there have been times where people have been like, you are irreverent. You are making fun of, like, a fundamental, painful part of the human experience. And, like, man, I'll make fun of my fundamental, painful parts of the human, like, because
but I've met clinicians that don't have that piece.
But how do they do it? How do you survive?
Those are the
without
ones
it?
that aren't as
I
well.
was gonna say, I don't
Like,
think
really.
they stay in the field too long. I think they tend to leave quicker because they're not able to adapt and deal with all the trauma and all the crises that occur.
You're working with people. You have to laugh. You can't take it.
Yes.
Like, it's just no way. I'm glad I learned that early on.
I would say I have like just enough childhood trauma to be funny. And I think that the same is true for like workplace trauma. Like you gotta have just enough to find the humor in the absurd.
Absolutely.
So
Absolutely.
I agree with that piece.
But do you really have anything to be humorous about if you don't have some difficulty? Like, there's no humor in everything being perfect all the time.
Right.
So you have to have some hiccups in there.
Absolutely.
And that's okay.
And that releases, I think, some of that pressure. I mean, I'll tell people we have this like auditor feedback report process, right? That is like terrifying to new clinicians. And sometimes I prescribe them to get a documentation step because that way, then it'll reduce the pressure of it. It'll reduce the fear of getting it. Is just, I want you to intentionally get a step, and then you don't have to worry about it anymore, right? You can see that you don't have to be perfect, and you can there's a playfulness about it, I think, where everything, it's serious. The world, we are dealing with serious business, and if you don't have ways like humor and connection that we're talking about to relieve some of that pressure, I'm not sure how you do it for at least any period of time.
I really like what you said earlier about like leading by example, and I mean that has taught me so much from the different mentors that I've had here. It just in CPT certification, like when you show the videos of you at your worst, you know what I mean? Like that is so helpful. And I really take that on and I apply that to the new therapists that are coming in. And it's like, here's me at my worst, here's the mistakes that I've made. You're probably going to make them too. It'll be fine. We'll get through it together. And just Crystal and Carl and, have both kind of led in the same way of, these are the things that I've not done that were so great. And then this is how I, move past it. And I think just seeing that authenticity in our behavior and realizing that, the people that make it are not the A+ students. They are the A+ students, but they're not the A+ students. They're not afraid to, get maybe that B- sometimes, and they're going to be panicky about it, which helps them learn how to not get the B- next time. But it's okay to get that B- every once in a while. Like, we'll help you figure it out. And that's definitely been my experience is, okay, this is how leaders look, and this is how you can help the next generation coming in really give themselves some grace in this field.
I just thought, that pay it forward concept, it's like failing forward. I feel like is a good,
Allow me to fail publicly for
me
you. So that's every time I make a mistake, that's why it is. It's entirely by design, Crystal. I love that. Completely planned out.
Yes.
And
I'm doing this for you.
It's
my sacrifice.
That's the 50% that people listen to me
Yes,
say, by the way, is all of the epic fails.
No, but I think the piece that maybe we need to pull in here is this concept of like the wounded healer, and that a lot of us come into this field not because we had a perfect existence leading up to this moment. I think most people go into the mental health field because there was a point in their story in which they would have benefited from contact with a mental health professional. And so I don't know everyone around this table's like your entire backstory, but I suspect, I see you all nodding, so I'm suspecting you're just like, yeah, tracks. And so like how many of the clinicians like that we've hired come out of that family of origin story in which they had to be perfect to be okay. They had to be perfect to receive love. They had to be perfect to be validated. And so they're coming into a culture and a context like PCS where we're like, hey, we've got you. You're going to make make mistakes. We have your back. We want to support you through it. And I was just watching an Instagram reel of all things yesterday, but it was a woman talking about how when you have challenging family of origin dynamics, you really struggle in adulthood to feel connected to healthy relationships because you don't trust them. Like if you show up with like narcissistic abuse or chaos or anger or rage, or if you're controlling, like that's familiar. Like I got that. I know what to do there. But if you show up with like love and compassion and affirmation, like I get a little squinty. I don't trust it. One of my favorite leaders here at PCA, who she is on her way out. It's really heartbreaking for me. I've loved working alongside of her, but she is having a baby and going to be a mom for a while. And so I think that's super cool. I have a lot of a little bit jealous, and then obviously just honor her journey. But couldn't be a stay-at-home mom. But when I first interviewed her, I didn't want to hire her because she was so nice, so warm, so much love and light that I was like, that can't be real. And like now that I've known her for like 7 years, it's so real. Like that's who she is. It's so authentic. But my initial gut reaction was like, listen, fakey fakertons. I don't know what's behind that. But when that mask slips,
Right.
I'm afraid of the Freddy Krueger beneath. So like, what is this? But it was truly authentic. But like my own shit got in the way of me accepting and receiving her positivity.
It's very true. It's very true. I was just thinking too, as in a supervisor role, then we get curious around why are you overly attached and identifying with the people that you're serving and not talking to me about things. But that makes a lot of sense in terms of what you said. So yeah, I think keeping and understanding, taking the time to, there's so many tasks, managed care companies.
I need to shout them out.
There's just so many. It's where
We can also add state legislators,
all the
auditors,
funding,
and
all
any
the
other
things.
supervising entities. You should probably have to live by your own rules before you make us.
Yeah, and it's overwhelming. Where you want to make sure they need to know how to do the job well, but also those stories, right? It's like let's do a genogram before we get started. Tell me about who you are, so that I know. Like back to your original question of how do we create that? And I think that looks different for different people. To your point, where me coming in, hugging up on you and getting all emotional with you might not work for all individuals that are onboarding. So that's a struggle for me, where it's like I want to take the time to get to know your story and pace it in a way that feels comfortable with you, but I got to teach you stuff too, right? You're going into a drug and alcohol eval and you got to know stuff. So just kind of the tension between those two, both of which feel like a priority.
Yeah, it's a balancing act. I started here and I was absolutely in survival mode in my life. And there's supervisees I work with and they are too. And, when you are in survival mode because of everything that's going on outside of work, sometimes being met with, we love you, it might be too much because it creates that release.
First day hug.
Yeah.
Not recommended.
Well, it's like, then I'm forced to release all of the things that I've been carrying for the last however many. Yeah. And it's like, I might not want to do that my first day when I'm supposed to be a therapist. So it's like, because to your point of, trying to be that A+ student. Like if I come into my first day, I got my master's degree now and I'm a therapist now and I lose it all over my supervisor's couch and I just sob because I've been in survival mode for a year. It's like, no, I can't do that. So I think that's why it's important to just pace that. And, when get to know each supervisee like we get to know every single client and treat everyone as an individual. I think that's so important because we do all come from stories and a lot of us have stories going on literally every day still. So, life is life. It doesn't not happen to clinicians.
It doesn't stop.
It happens to us too. Yeah. So I think just allowing them to know like, hey, this is here. This is the vibe we put out And I'm going to keep coming alongside of you and making sure you understand that we're here for whatever that needs to look like.
What do we do, or how do we support a clinician when the supervisor, because I agree, I think the secret sauce is in the collective, right? Like that's where the power is. And I've believed that, for my whole life. I mean, my most difficult moments were made slightly less difficult because of the people around me. And many of them, like, would I have made it through without them? Yeah, I like to think, I like to think I'm a badass bitch and I get on through. But probably not when we're being truly authentic with it. And there are times where the need of the provider stretches beyond what would be appropriate for the collective, for the group supervision, for the supervision hour. And I've sat with supervisees who are really struggling, and I have that moment where I'm like, oh man, like it feels like I'm doing therapy, and that doesn't feel right. That feels like an overstep of my position and my role. And, in the moment they're there for it, but then you also like, so how do I walk? Because we are all also therapists, like sort of first and foremost, before we became supervisors and moved into administration or leadership or whatever it is. And there are times where I need to kind of fall back and say like, hey, that's an individual therapy scenario, and I want to create space for you, but I also need to say I see that, and this isn't the place for that. So how do I help you get it where it needs to go?
So supervising recovery specialists, that definitely opens that, because part of that role is making sure that individual's recovery still comes first, which is very challenging when they're in a role where someone might walk in their office and hand them a bundle of heroin that day. Like you never know what they're going to face. And so checking in on their recovery, but having those boundaries between, this is how I check in on you as your supervisor. This is what you need to do in your recovery program. And then this is what needs to happen for that, mental health treatment component. And just painting a picture that they all serve different spaces in their life and they are all needed for different times. But just making sure it's normalized. I will never forget my first week at PCS. I think it was Carl was like, get your own therapist. And I was like, that's a really good idea, Carl. And like just that normalcy with that made me feel like, wow, okay. Because I have a criminal justice background. When I worked at the prison, totally different vibe. There was no such thing as trauma. There was no such thing as caring for your mental health. So coming into this environment, and it was like, no, we recommend, like, go do that. And I think setting that normalcy, like, go to meetings. Like, if you've got to leave work early to hit a meeting today, let's do that, because your recovery absolutely needs to come first. Like, are you setting proper work boundaries and things like that? But I think it really just fell back on me to make those boundaries very clear and push that, like, let's get you set up elsewhere for those other needs that I can't do as your supervisor.
I love that you brought boundaries into the conversation, because I think that is one of our greatest opportunities in this field. And I think the research suggests that's like the one thing that actually works when it comes to recovering from stress, burnout, vicarious trauma. Like, boundaries are where the secret sauce is. Absolutely. And so often, like, I'm sitting with a provider that's like deeply hurting, and maybe life is like just shot up and smacked him across the face, and then work, because it's never just life, right? It's never just life. And then the most impossible client scenario you'd ever want to encounter shows up next, and then like maybe an audit on top. I don't know, but like there's always it's just like a light smattering of sleet. I don't know, like, the road shut down, whatever it is, your kid gets the flu. But it's never just that. And I think that I've sat with clinicians that are like really hurting, really suffering. And then I go back to like because I'm up here, so I have my like ancillary leadership that also support. And so I go to like their more direct supervisor, and I'm like, hey, can we donate some PTO to this person? And because they need a day, they need to take some time. They're not well. They need to step away and allow them to heal in the absence of the work stress. And can I donate some PTO to them, or what can we do there? And then the supervisor comes back to me and they're like, well, you can, but they have 287 hours of PTO.
New problem.
And it's like, well, dang. So then I go back and it's like, I've noticed you have 296 hours of PTO, and perhaps
guilty parties at this table right here.
I was
Are
going to
there
say, are
guilty
we?
partners?
Should we look around and ask who has what PTO at this table?
I'm a hoarder of
Yep.
PTO.
Yeah.
Me too.
It's a do as I say, not as I do
Okay,
scenario.
okay. As long
Elise.
as we all understand
Y'all
that.
don't
'cause
want
I
to
was
know
like,
what I do with my PTO. I plead the fifth.
Exactly. I saw that on every face at this table. Isn't that interesting?
I absolutely don't work and put it
I always
it's
tell
on there
them-
anyway.
I always tell them, I'm going to give you this best advice. Don't do what I do. I said, you're going to see me here all the time. I want to answer you all the time. Don't be me. Be you. Put the boundaries in
Learn
place.
by example. Use your PTO.
Yeah. Or keep it and hoard it.
For,
Listen, you can cash it in. So
You can,
really,
yeah.
That's true.
The end of the quarter.
that's
When I like to
reinforcing.
cash mine in.
So I'm just saying. But
Or have a baby, maternity leave. That's why I hoarded
that's
mine
good.
for.
Right? See, no, that's perfect. That's perfect. Yes. But I think I do always say I struggle to put those boundaries in place because I want my staff and I want our clients to feel supported and that they have someone all the time at probably my own, demise sometimes. So it is hard to set boundaries. But we also, so this sounds a little corny, but for my programs, we have like a token economy for adults, which is they earn points they can cash things in for gas, because let's be real, that's expensive and they all drive around. But like, I give them points for self-care. So like you get that's the most points they can earn is for self-care. So if you take a day for yourself, if you actually use PTO, because I'm one of the ones that like, you can work more at the beginning of the week and still take off on Friday, right? Like,
I know.
Right. I don't got to use that PTO. But that's not good with boundaries. So like, if I have a staff that does that, yes, does that hurt our utilization? Sure, it does. But also not having that staff at all would hurt our utilization. So like, I want to keep them in good spirits. So I do anything I can to reinforce that they do that, which can be difficult, especially when I don't do it myself. But I always tell them, don't be me. Don't be me.
My kids have helped me with balance a little bit. My husband was terrible with helping me with balance because he's an introvert, right? So if I'm not home until 9, like he gets to be alone in the house. And like that's crack for an introvert. Like that is like, wow, alone time. But when my kids rolled along, there was a different need for balance there. And so I really do try to lead by example. And still, like if I'm just taking a day, I'm going to make up that day in the rest of that pay period. You can bet your bottom dollar. But I really do try to have like a week where I am off. I really try to prioritize family time where I'm off. And it's really hard. But something I've noticed is there are times where I'm connected where I don't need, like I'm sitting in my kid's Little League game and I'm like responding to like a resignation on my phone and like I'm not watching him and he gets his first hit and he looks over to see if I'm looking and I'm not looking, so there is that like the necessary balance. And there are certainly times where my kids do not contribute well to my stress and burnout, right? But that's a different pod. The motherhood pod's in a couple weeks. But they are a good accountability partner because my kids will look at me and be like, Mommy, can you, like, are you looking? Are you watching me? Like, can you see me? And that's a really good reminder, like, put your phone away. It's 7:30. The resignation is in. Nothing's going to change. You can deal with it tomorrow or later or whatever. But it's a hard habit to break for sure.
That mentality is what I've adopted, though, too. And my husband actually is opposite of yours in the sense that he's an extrovert. So he's helped me get out. Like, I can be an extrovert, but I do so much talking at work that by the time I get home, I'm like, I'm good. Yes. But he helps me, shameless plug, but he's a TikToker. And he's kind of famous in a way. So he gets invited to a lot of, like, events and things like that, too. So it gets us out of the house a lot. More than I would probably like. But the good thing is because we're out there, I can't be on my phone doing work. I can't do all of those things. And so being with an extrovert just gets me out of my own bubble, and I can't focus on work. Like, I just can't. And also, too, like, I work till 7 p.m. every single night. So by the time I get home, well, Monday through Thursday, because I don't work Fridays, because, you know, I can put all my hours in Monday through Thursday, like you were talking earlier. But he gets home at 5. So we have literally, and then he has to go to sleep at 9. I'm sorry. Yeah, 9, because he works at 5 a.m. So I only get 2 hours a night. And maybe that'll change when we have a kid. We'll figure that out. But those 2 hours are precious. Like, that's, I have to get off my phone at 7 p.m. when I get home. And we have established that, too, to have dinner and do life stuff for those 2 hours. And then by that time, I'm ready to chill out and do my own thing after when he goes to sleep. So, I think even when we were talking earlier, or when this first topic came up, I think your home life also, we've talked about the work life, but the home life to me is actually even more important than that. Like, the work life, I mean, the home life balance is really also a key factor as to why I can be here. I think about, I have a crisis, you know, component to my job. So I have to be a first responder sometimes. And I can almost 100% guarantee that after I go out on a call, I'm coming home to a clean house, maybe some wine when I was allowed to drink wine. You know, the dogs are taken care of. Everything is taken care of, because my husband now has been, I make fun of him. I'm like, you're trained now to be with a therapist. But I think that's what it is. Like, he knows it's stressful, those moments. So when I come home, he knows to have it the way we like it, and the vibe is good. And some, not that I would ever pray for a crisis, but sometimes when I go, I'm like, I can get through this. I'm going to come home to the best, like, ever. And, you know, so I really think, like, training your spouses and training your children is really important, though, to keep up with. That's the reason I can have boundaries at work, because then I know when I get home, like, I have those set boundaries too, and I'm not going to go past that. There's just, that's the way it is. So I feel like my home life contributes more to what I can do here at work and everything. Really important.
Yeah, I try to end. I do the startup boundaries training for the new outpatient therapists, and
you train on that.
Yeah, and I try to. I don't know. I'm contemplating, because What About Bob is like a really old movie from maybe even the 80s. I don't know, but it's about a patient. Richard Dreyfuss is the therapist, and the patient follows him on vacation. And I used to show this scene from that movie where, and it's like hilarious, and a lot of other things happen, but they're sitting around the dinner table, and he's like lost it, right? Richard Dreyfuss. So he's like, this guy's got to get out of here. And his kids are all around the table, and they love Bob, right? They like love Bob. And so he kicks him out of the house, and the kids are like, oh, how could you do that? And Richard Dreyfuss goes over, and he was like mid-conversation. He goes over to the door, and he says, do you think he's gone? Do you think he's gone? And then he opens the door, and Bob is still standing there in the same conversation. And I went to a supervision training one time, and she referenced that movie and said that she had worked with somebody who could not watch that movie because their father was a psychiatrist, and it resonated so much with her experience of not having having a physically present sometimes, but not having an emotionally present parent. And so, you know, we talk about the PCS mission is around the value of people. But these other people, right? So your trained spouse, or your dog that's waiting for their food, or your kids that are, I don't want to be the mom that's picking up the last kid at school, like, you know.
The one that's sitting on the curb by themselves.
Saying, you know, with the staff looking at their watch, right? Like, they should never feel any less valuable than anybody that I feel a tremendous amount of passion for helping here in the job. So I think that's helped me, and a passion for myself, you know, that I love a lot of people, and I love a lot of things too, you know, that deserve my time and energy as much as everybody else here does. So that's helped me too.
Crystal, what's really resonating, well, a couple different things you said really resonated with me, but I think specifically this idea that once upon a time, my motto was always, I'm doing my best. I'm doing my best. I'm giving my best. I'm giving my all. I'm giving it 100%. And then I think it was sometime in 2020 where I had a life crisis. So my husband lost his father, and then very quickly after that, my brother passed away. And I was giving my best, and I was giving my best, and I was giving it all. And I was giving it all at work. And then I got home, and my kids would be normal 3 and 1-year-olds, or 2 and 4-year-olds, like normal kid stuff, just doing what you do when you're 2 and 4. And I had 0 left in the tank, or I had negative left in the tank. And I walked away from those situations like, ah, shit, man. So giving it all, like doing my best isn't my motto anymore. Now I give 90%. And I leave a little left over because someone else is going to come and take that too. Like, I know that. I know. But at least now I'm not drawing from empty. And making, like, my kids didn't wake up one day and like, I want mommy to be a psychologist with a savior complex and delusions of her own agency. And yet that's what they got. So supporting them in kind of seeing my struggle, seeing the challenges, talking to them about how they don't want to go into the social services, and supporting them at being really good at math so they can become engineers.
This TikTok thing you were
TikTok
talking about.
sounds great. Professional basketball. You know, we have a lot of really lofty goals, but never am I saying, like, you should be a psychologist when you grow up. I'm like, no, you want to be an engineer? Great. Let's get some more math
Go
classes.
with that,
But I think I think we feel guilt then, though. Because there are times where they're like, hey, can you cover this? Or can you do this? Or can you do that? And, like, technically, yes. Technically, yes, I can. And, like, I'm pretty resilient. I think I have, I've got some internal resources. I have education and support. Like, I've got a lot of things going for me that I can tolerate that. And I can do it. But at what cost?
Right.
And I think so often we fail to ask ourselves that at what cost question, like, who's going to pay for this? And most of the time it's my kids that pay for it, or my husband, but he's fine.
Yeah, I definitely, I had to do your best at work and then also have to do your best at home. You know, do your best at work, and then my wife got randomly diagnosed with stage 3 stomach cancer, and then I had to do my best being her caregiver. So it was like, do your best all day as a therapist, and then go to Hershey Medical Center and spend your night there, trying not to rip a doctor's head off of his shoulders. They got my rage more often than not. And it was to that point, it was like, who is paying for all of me having to always do my best in every single piece of my life and never being able to turn it off? And it was myself. Like, I was paying the cost for that, and then other people, like doctors, that unfortunately got my wrath at certain times. And it was like, where do I find that space to just not be my best? And that's, I think, where, you know, having those supports and stuff like that is so important, because there are times in our life where we don't have a choice but to give our best. You know, we need to make an income. We need to deal with life. And so when do we actually get to stop for a minute and, you know, having our own therapy, having our own support network, having supervisors that are willing to say, let's just take a minute, you know, and that is so helpful. And it made me step back and realize, you know what, maybe my best looks different right now, and that's still okay. Maybe I don't need to be running, you know, 3 groups right now. Maybe I can, like, take that off my plate, and it's still my absolute best. And I did have to recognize that, because things need to shift depending on the season of your life.
Yeah.
I think too, giving, I don't know, in my field, giving some of that responsibility back to the client is what I've learned too. being as though I work in an intensive program for only 8 months and we see them 3 times a week, probably sometimes more. I know there were many times I would take on like the stress of what's going on with my clientele, and I had to really learn how to give it back to them that these are their lives. This isn't my life, and you've got to also do the work, and I can't carry that for everyone. I can't, because then I won't be able to do my best in all the other parts of my life. But I just know that that's also been helpful for me too, giving it back to the client. So I don't want it. Like, take it back. It's yours. Our session's done. I'm going to go to another client and take on some of their stuff during the hour and a half I have with them. But right at the end, I'm anchoring that session and I'm putting it back on your plate. So then I can focus on what I need to do, outside of work and all of that stuff. But
I think that's just another boundary, though, that like we're required to set. I mean, so often I can think about time, especially when inpatient program, where I was like on call 24/7. And like if a client disappears in the middle of the night, I had to go in. If we had a client overdose on Thanksgiving, I can remember like the turkey got burnt and I was at the inpatient facility running a group with the remaining clients. And I think so often we take that on when it's not ours to carry. And I see that a lot with our younger, greener, bright, and I don't mean like chronologically young, but I mean in terms of years of service within the field. I see them holding a lot and say like, and looking at them and really challenging them to consider that this isn't theirs. And it also, and I think the inverse of that is also the story's not theirs. I think there are times where that vicarious trauma, you hear the story, you hold on to it, you grieve the story. And I've had to challenge myself, be like, well, wow, but it didn't happen to me. Why am I holding this so tightly? Now I need to look at me and see what parts of me this is like what's showing up because of it. But so often, we're over-functioning. We're working harder than they are. We are taking them to job interviews and helping them fill out applications and like doing all these things. And then they won't show up for their first day at work. And I can say like, but some of that you only get through experience, like the experience of doing it, over-functioning, realizing that even in all of your over-functioning, it still didn't work and you still didn't achieve your desired outcome. Maybe because of the over-functioning when you really let it sink in. But that is so hard. I have a couple things that the research tells us will serve the field if we can do it. So the first is self-care, but like real self-care, like exercise, meditation, hobbies, and spending time with loved ones. And also self-awareness, like recognizing the early stages before you recognize the late stages. And that's hard. That's hard. I mean, I think just even like in my own parenting journey, like I really try to do gentle parenting. But my kids aren't gentle. I'm raising 2 boys. They're not gentle. And so I'm like, buddy, baby, friend. And we like do the thing and we do the 5, 4, 3, 2, 1 game and the grounding and the deep breathing. And then I get kicked in the teeth. And it's like, okay, friends. Like, but that's the but I'm fine. I'm not fine. And I think that I see that a lot in my parenting because it's like a really quick progression. But I think as providers, there are times where like, we're fine. Wait a minute, they're out of Diet Coke in the vending machine. I'm not fine. But we probably weren't fine for a few steps before the Diet Coke ran out. Professional boundaries, which we already talked about, supervision and consultation, which we've already brought into the discussion. And what I can say is in 2020, I was struggling with some of the worst burnout I've ever experienced because my job was really hard, like leading a community mental health organization through a global pandemic. I was 36 years old. My boys were 2 and 4. I hadn't slept through the night since 2015. I had 650 staff that I cared about and like 30,000 clients. And then my father-in-law died and my brother died and my best friend died, but she came back. and my dog died. I even forgot about Lola and all of that. So it was like just this nightmare year. And I was sitting there thinking, like, how do I do this? And what I did is I got my own therapist after being on a wait list forever. Yes. But I got my own therapist eventually through sheer stick-to-itiveness and harassment, maybe. I also got back into clinical supervision, which was weird for me because I'd been independently licensed for like 10 years at that point in time. But as like the executive vice president of PCS, like who do I talk? You know what I mean? Like, yes, I can go to my collective, but at the end of the day, like if I were gone to Crystal and been like, I'm freaking the fuck out, man. Like, how do I lead Crystal through it? Like, it's my job.
Me too.
It is my job to show up with the calm. Like, guys, we got this. It's all going to be okay. True. So you're doing family-based in camp chairs outside in 32-degree weather. You're good, baby. You're good.
We invested in other chairs.
You got other chairs.
There's no way I was balancing
those
on
camp chairs. None of those camp chairs.
It was a little precarious. Yeah. It was.
My only one cheek fit on it. So there's no, I'm having a balancing act the whole session.
No, we needed different chairs. But so I can't show, but I got into clinical supervision with an LMFT outside of PCS, and I could go to her and be like, I'm freaking out, man. And she was like, we got this. And I'm sure she's freaking out somewhere else. But at least, but I had my space for it now, so she's got to find hers.
So important. So important.
Absolutely.
So that supervision and consultation, peer support and networking, again, the power of the collective, I think, is unparalleled. Something we haven't talked about yet is continuing education, like continuing to deepen your practice. I think that's one of the coolest things about family-based.
I have a story about that one.
Training is, well, tell us your story about that one.
I'll do it real quick. So, like, maybe she was my second client in family-based. I was with Norma at this time. So it was like back in the day. I know, I love her. I'll see her tomorrow because she's going to my baby shower. Yeah.
Give her a big hug for me.
I will. But I was not really well-versed in hearing about a lot of sexual trauma. It was one of those things that obviously till this day grossed me out, and I just don't have a stomach for it. Well, I really didn't have a stomach for it then. So we went to a client's house. I had just eaten a Big Mac, fries, a Coke, ready to go. And there's you kind of already know where this is going. And she was an 18-year-old client who had been through some severe stuff. And we were doing her history timeline, which is one of our assessments. So we started the session. She starts diving into everything, some grotesque things. I could not stomach what was going on, so I ran to her bathroom and literally vomited everything I just ate. And I missed the toilet, okay? So all over the shower curtain, all over, I'm glad we're not eating. Disgusting, yeah. And so I'm like 2 months in, so I'm like, oh my God, I can't do this job, oh my God, what am I doing, you know? And then what made it worse too is this mom heard me, and she refused to have me clean it, and she was disabled. Like, her hands were disabled. She refused to let me do this. She cleaned up everything, which I felt even 10 times worse about it, because I'm like, I have full functioning range of my limbs. I can do this. But secretly, actually, if I smell my own vomit, I'll re-vomit. So I feel like...
Probably worked out better.
Yeah, so it did, but then I still felt like guilty about it. And, you know, after that whole fiasco, I went to the car with Norma. I'm like, I just don't know if I can take any sexual abuse clients. And in family-based, you don't really get a choice on your clients. So I knew this wasn't going to be my last one. So Norma and I decided to go to the SARC, the Sexual Assault Resource Counseling Center here in Leb, and we did a whole 40-hour training together, and I became certified sexual assault counselor. And I worked on their hotline and things like that for like 2 years. And on that hotline, you hear everything too. But what I did was kind of desensitize myself, and I got educated more on what was going on. And now I can sit through any story.
Your story's giving me goosey.
Yeah, but the continuing education, like if I didn't do that step, I'd probably still be struggling with that. But I knew I needed to do something, and I was green and ready to, so I was all about it. I was like, I need to do this. But all because of that nasty story. But now that's one of the humor stories that I actually tell people. So, because now I can laugh about it.
Your first
terrifying back then,
I puked all over a client's bathroom.
Yeah, everywhere.
Top that.
Yeah, and a Big Mac at that. So it wasn't like a nice little salad. No. It was nasty. But yeah, I'm sorry. I just had to put that in because
fantastic.
I'm all about educating and kind of like with your airplane thing that we were talking about earlier, just desensitize yourself, exposure therapy, just get it
great.
out, and then you're a little better with it, and then you can move forward.
Yeah, I mean, I'm a huge fan of continuing education and just education in general. And I feel like even when I met with a client, like that client, because I mean, I still meet that client that has the story that I'm like, oh, this is new.
Yeah.
I'm not, I've done this for about October will mark 20 years as a therapist for me. And I think there are still times where I come into contact with a client story and I'm pretty good at being Dr. Ernest in the moment. Like, tell me more. And then I get out and I'm like, oh my goodness, what do we do? And I have enough education. I have enough theoretical knowledge that I just lean into the model. I use that education. I lean into, but I also have a lot of anxiety because a lot of our workforce right now don't have those same levels of education and training. We have a lot of bachelor's level clinicians. I know in both of your programs, tons of bachelor's level or not bachelor's level clinicians. I know you have CRSs that often have their own stories, and then they use a lot of themselves within the room. And for me, when times get tough, I can lean into the model. Dr. Ernest can show up and I can cloak myself in like my credentials and my education. And I'm like, well, studies show that this is effective. So I'll do the thing that studies show are effective. But if you had like a 40-hour CRS training and that's your experience up until now, what do you lean on when you inevitably meet that client whose story is going to hit your story in a way that's like, ooh, that's smarts.
That's true.
So we know like flexibility and having balance. So making sure we set those boundaries so that we can be balanced within our work life, which is almost funny to say out loud, but in theory it helps. Mindfulness and stress reduction techniques, and literally anything we teach our clients. So often this is like one of my very first caveats with the clinicians that I'm supervising. When they're saying like, hey, I'm really struggling. And this client is really impacting me. And it's like, oh, well, what are you doing with the client? Well, I'm teaching them mindfulness. When was the last time you used mindfulness? Crickets.
What's mindfulness?
What's mindfulness? And so I think that like falling back and doing some of those different things. And then last but not least, I think it's something that you said earlier, which was like that debriefing. Like you get into the car with your partner and you just let it all hang out there. You process it, you talk it through, you shed some tears if you have to. And then you're able to like move on to the next thing, but you have to let it out somewhere. And if you don't, I don't know how you can function. And then last but not least, I'm sorry, I thought I was done, but I don't. Therapy for themselves is the big one, and regular breaks and vacations.
I'm surprised. Well, I guess this is a community. Like, I don't want to get too religious, but like I'm a Christian, so going to church regularly it is like, what was the word I was going to use? But it basically sets the tone for the rest of the week. Every Sunday I'm there. I'm a youth leader, so I have to give back to that too and give back to youth. But sitting in a service and getting my cup filled again through community and things like that is one. Actually, it's my number one too. I know I've said like this helps too. There's so many things, but God, I would not do this job. My supervisors ask me all the time too. They're like, how are you here so long? Like, tell people. I'm like, well, I can't get too religious, but it's God. And then my supervisors are like, no, but like, really? I'm like, no, I'm telling you the truth. I was like, I was not a Christian right now. I was like, everyone better be happy I'm a Christian right now because it just wouldn't look this way. But that also, I think, and like, I think that lays into community because that's really what it is. Like the community, the church community that I have anyway. That helps me with everything. Helps me be able to do all the things you're talking about. So, not to get too religious. Sorry.
No. I think nurturing your spiritual self, however somebody defines it, is what is really important in that space. Because I think so often we're divorced from our spiritual self, or we try to put some lines like inside between our spiritual self. Now, my caveat to that is like if you choose to give back. I was doing a training last week on working with adolescents with problematic sexual behavior, and one of my trainees, I always talk about stress and burnout in that context because it's a hard job, and so one of the trainees said, well, I find that like volunteering with kids and adolescents, like in a mental health setting has been really helpful to me. But like my warning to that is always like, but don't tell them what you do for a living. Yes. Because then you're volunteering but you might not get that reparative experience. And back when I was actually in IBHS in Dauphin County once upon a time, and my job at the time was community liaison. And so it was my job to go back and forth between the families, the system, the schools, and the managed care companies to advocate for the kiddos to have access to the resources that they needed. Growing up in a household that received TSS services to the tune of 40 hours a week, I know how much that can change not just the life of that child, but the life of the family system. So my brother had a lot of direct care helpers within the home. So obviously that's close to home for me and something I was really passionate about. And it was back in the early 2000s where if a client showed even an ounce of improvement, the MCO would immediately cut their hours 50%. And so I would have to with the families, the mom would be like, oh man, we had nothing and now we have 40 hours a week and it's life changing. I'm like, yeah. Yes, yes, but make sure you answer this based on the current symptoms, not the difference between 2 weeks ago and today, because otherwise we won't have enough hours to consolidate our gains. And I think the culture's changed just a little bit since then. I don't think it's near as bad as that was. But what I found is that it was also my job then to go back to the families and be like, hey, your hours got cut. And sitting with the families after their hours got cut and fighting with the managed care companies that would say, pretend they weren't in the office, because I can be a bit pesky. And so at that time, I decided I want to volunteer in a positive experience. So I started volunteering at my youth group, but they knew what I did for a living. So I went to my church, I volunteered with the youth group, and they gave me the problem group, the problem small group, the ones that yelled penis and vagina in the middle of the church service, the ones that when we went shopping for the girl, we adopted a teenager with HIV one year for Christmas, and when we went shopping, I caught them shoplifting. The one that when we went to the old folks' home to give back, they were pantsing each other. And so that, yes, I think we need to fill our cup. And sometimes you fill our cup by giving back. But don't tell anyone what you do when you volunteer.
It's
tell
so
them.
hard, though. I wear it. I wear it. I
you
don't
just have
tell
a social
people.
work vibe, don't you?
This happens at the grocery store.
Yes.
People just dive into their lives, and I'm
I was
like,
just sharing that dream team this week.
yes, and then it's just therapist written. Yeah. I swear to you, it happens everywhere I go. I check out at Rudders, the cashier starts crying. I'm like,
Yeah.
I can't.
Absolutely.
So, gosh, thankfully the youth group, I'm with the 7th graders right now, and then you follow them up until they graduate. So far, they're okay. But
No one's shoplifting.
not yet. I haven't gone to a store with them yet, but but
Stay tuned.
But the youth pastor did announce it, that but he also made it very clear to me though too, this isn't your role here. Do not take on any of that. And if someone is going through something deep, you let me know. And then he'll go the avenue that he needs to go. So my girls know, don't dive too far in. I'll be here, but don't dive too far in because I can't do my work here. So, yeah. But no, I wear it. I wear it on my head all the time.
So we do have a couple of questions for today. And so one of them was, how do we cultivate resiliency in the difficult work that we do? And so I did a bit of prep for that. So I'm going to run through those real quick, with it being emphasizing client strengths, coping mechanisms, and having really big eyes for the client's own resiliency. Celebrating progress over perfection. And sometimes that means redefining what success means within each client and caseload. And I think that's another thing that especially early career clinicians often struggle with because they have these really lofty goals. And sometimes realizing that where they want that client to get to might not be attainable today, but really celebrating the steps and stages along the way to that. Focusing on post-traumatic growth. We started this conversation with at least I have enough trauma to be funny. But I think that it's more than just a great sense of humor that can come out of a shitty situation, perspective, values clarification, things you've learned along the way, and explore with clients how they've learned and grown through some of their painful, helping them make meaning out of the experience. Practicing gratitude, utilizing mindfulness are all really big solutions. Practicing self-compassion, which is so much easier said than done. having a very reflective practice. So often our eyes are drawn to what's broken and what's not working, that we gloss over the things that are going well. And so like reflecting and looking at all of it, not just what's going wrong. And one of the suggestions they had there is like use a journal to capture moments of vicarious resiliency that you witness in your clients or supervisees. Setting boundaries. I loved this one, which was practicing cultural humility, like recognizing there's a lot of things that you don't know about your client's individual, like background, social locations, and cultures. And you might be looking at something as a problem when really for them it's not. It's just a part of their fundamental human experience, and recognizing their unique strengths and resiliency there. And then last but not least, focusing on that growth mindset, realizing that we're all learning, we're all growing, it's all a journey. So that's what the research says really works when it comes to cultivating vicarious resiliency. But anything I didn't say that y'all have noticed that really allow us to grow vicarious resiliency?
I don't know. I think maybe an example of one of the things that you shared, I love emails. No, I don't love emails. I really don't love emails at all. And I get a lot of them. And so I actually looked at this before coming here today, and it just like made my heart smile. I have an email subfolder that's called Reflections for... Are we allowed to say the F word? It just says F-its. Reflections for the F-its. And I started that...
You are allowed to say the F word.
Okay, yeah. And I started that a couple years ago. And it's like these snapshot moments, right? It's the messages that you get, the emails in the sea of other emails that are like, this really cool thing happened today, right? Like, we have a program that is the absolute best example of that, where we want to get them isn't a reality, not only today, but probably ever, right? If we're just being realistic about it. And so we've got to really, the latter rungs of progress are so close together, and we have to really be intentional about recognizing that. And the supervisor of that program from several years ago used to send me, and we'd call them campfire stories, because we both used to work in like a partial program, and you could feel the passion. I mean, I think that's something I was thinking about earlier and we didn't talk about, where the money is right. Like I want to be able to pay my bills. But for me, it's like what ignited my passion. And I was 16 years old when I decided to do this job. So to your point, like I didn't coincidentally land here, right? So, and there was a passion, a fire in my heart that was started at that age. And that's where I go back to, is I had the opportunity to go into a prison with like my Jansport book bag to interview this woman. And I just kind of had an interest in incarcerated mothers. And I interviewed her, and she told me her story, which was vastly different than my own family of origin story, right? But it just ignited a passion in me that is what I go back to, right? And so that program for me takes me back to my first internship at a state hospital working with severely mentally ill individuals who've been some institutionalized their entire lives. And so when I forget, or when I get lost in like, this is hard. I don't want to do all this paperwork or whatever it is, those stories of and it's of their resilience, right? It's of sometimes they're hilarious, right? Sometimes they're just heartwarming. Sometimes I watched a person pace, it's like in a gymnasium, and I would go up there every week, and the person would never make eye contact even, and they'd pace listening to their radio, blasting headphones. And one day, they looked at me. And then the next time they looked at me and smiled, and I thought, all right, that is what it is, right? It's sometimes just that keeps me, that fills my cup to be able to go at it another day, right? Or answer the next 20 emails, the parts of my job that I don't really love. So I keep that folder, and when I'm struggling, I go back there. And sometimes I have to read just a few. And sometimes I have to spend a minute there with those stories that just, make my heart smile. because we get wounded still, you know, that's the moral injury stuff, I think, you know, it's, somewhere I saw them describe that as like a wound to your soul. And I thought, my soul's been wounded over the last 20 years. My heart's been wounded. And so anyway, I think that's reparative, those moments of like, in the midst of all of it, we are doing good. Yeah, because someone smiled at me today that probably didn't smile at anybody else for a lot of days. Yeah.
Our supervisor keeps like a little manila folder for each of us, and throughout the years that you're there, she collects things that clients send in or like stories. Like sometimes I just want to like rip it open, but then I also like I want to wait whenever I move on to something else or on those bad days like to rip it open and see, but it's all those things that you're talking about. It's just not in an email form. But then I also have on the side of my fridge, like a little shrine is what I call it. But it's like little drawings or paintings or something that like a client has given me. And excuse me, I don't know, that brings me back to those moments too. And brings me back to my roots as to why I'm here on those tough days. And I pass my fridge every day because, you know, I eat. But it's beautiful. Like, they draw me, so some interpretive drawings.
Love it.
But I love it, and it brings me, I don't know, it fills my soul. It really does, and it just reminds me why I love working with kids, why I stay here, and those are the times I look on those rough days. I go to those all the time, the times, because I really have trained myself to find the positive in every day and try to see like what's going on. So I do take those little moments, but sometimes they punch your soul sometimes, some of these things that happen at work, and you need something more reparative than just seeing the silver lining each day. So
Yeah, I think that's why I like, you know, CPT, cognitive processing therapy so much, and Kim knows what I call session 12. It's my drug of choice. But it's because I work with someone who has this intense trauma story. Just years and years and years of different traumas and crippling substance use. And in 12 weeks, they completely change their entire perspective of their world. And it's miraculous. It's like the first time I got through 12 sessions, I was like, this is it. This is where I belong. Because it's
it's plodding.
Yeah.
Like they aren't 12 easy sessions.
No, it's a climb up the mountains to get there. And a lot of individuals don't finish. So those individuals that do get through that work, that do make it through, and they do get that, and they sit there and they watch their own writing, they read their own writing to themselves. It's not even me. I'm just watching them like this, smiling, waiting for them to hear their words. And, you know, just seeing that smile come on their face or that look of triumph, like, wow, it is possible to heal from this. Like, I don't have to keep picking up my substance of choice. I don't have to keep going back into these violent relationships. Like, I can choose something different for myself. And, you know, trauma work is not easy, but I will tell you, like, that getting there with those clients, it's just like the best thing ever. And every time I do, I'm like, yeah, there's nowhere else on this planet that I should be. Like, this is it. Like, this is where and it makes it could be the hardest day, a long 12-hour day filled with trauma. And it's just like, still, I leave work with a huge smile on my face. I'm like, my client killed it. You know, and that's so awesome. I love seeing them realize their own resiliency, without me having to say a word. They just are seeing it all on their own, and that's so cool.
Yeah, we call it the family-based vortex. Like, that's why if you stay past a certain amount of years, you're in the family-based vortex. Yeah. And that's, you can't get out. Like, you can't get out.
Yeah. I think, like, as we're talking, or you're AFA, it's like you can see it, you know. And I was thinking when you first started, normalizing that if you don't have that, or if you can't find it within a certain period of time of working here, this might not be the place for you. And that's okay. You know, it's okay if Starbucks is the place for you, or whatever, you know. Because I think sometimes I see people trying to force it. And if you just have that, right, where that light in our eyes when we talk about those moments is, I think that's what we come back, that's what fuels us to keep doing it, no matter what, all the other stressors that we deal with. And so I think trying to connect people back, just to answer the question that you had, trying to help people discover what that is for them, and then constantly finding a way to become reconnected with that if they get a little bit lost. And if they don't have it, saying, it's okay.
Yeah.
If this is not for you,
That's important too, because my first job before I came to PCS, like right when I graduated from college, 3 months later after the summer off, I went into a school. It was a lockdown facility for children with autism. And I was 22 and my client was 6 months younger than me. Wearing diapers, nonverbal. I still lived with my parents at the time, and I came home every day crying for months straight. And I was like, there's no way I can do this. Like, and my parents were like, I don't know you went to school for this. Like, what do you mean? Like, this is your field. Like, I don't understand. I'm like, I'm not cut out for this. Like, I can't have a client that is literally the same age as me. Not like I'm here working, making money, and this is life. I till this day, there's a certain level of autism I can't work with. It's just the sadness that comes upon me does not make me an effective leader, therapist, anything like that. And I think that's what drove me. I did IBHS work for 1 year, and then I went to family base, and I know that I need to have clients that can verbalize, can talk to me to some degree, because I still work with like little ones who struggle sometimes. But for me, that's my boundary, and I realized very quickly I could not work with a certain population just because I'm too sad. I don't know. It would take too much of my life, just like it did. And I did that for like 1 full year. Now I got to change within like 3 months with that client, and I still wonder till this day, like where he's at, things like that. And it did traumatize me. It really did. But like I said, I learned very quickly, I can't do that. I can't. It's just not going to work for me. But
I have a similar experience with the prison. It was definitely, when we talk about moral injury, I had recently moved back to Pennsylvania, so I had no idea the gravity of the heroin epidemic in Pennsylvania. Had no clue. I grew up as a military brat. I lived all over the place, so I had no idea what was popping off back in my hometown. And I come back, I get my bachelor's degree in criminal justice, I start working at the prison, and I realized that, I became part of that dehumanization of the inmates or the offenders, because that was the only way I could survive that. And one day I remember very specifically, watching someone in a restraint chair detoxing, and she was very young, and I didn't know if she was ever going to get her cognitive function back, because whatever she was using she was just hallucinating constantly for like 24 hours. And I sat there that whole time that I had to watch her, and I was like, ow. It felt like my soul was being injured. I was like, I've got to do something more than this. Like, I'm just like an adult babysitter and I can't do anything. I felt like my hands were tied behind my back. Yeah. And I was like, I need to go back to school. I need to go do something in the community, because I can't, when the hospitals close, the prisons are just overwhelmed with mental health and addiction, and it's a revolving door, and the only thing that closes that door is death. And I'm like, no, this can't be it. I've got to do something. And that's what drove me to go back to school and, leave my cushy county job and get my degree specifically in addiction. And that's why I wanted to work in York. I wanted to be closest to Baltimore as possible. Like, I wanted in it, because I just saw how it was just there, and there was nothing happening. And I was like, oh my gosh. And, that injury that I literally can close my eyes and remember the exact moment it happened. Yep. And I was like, this ain't for me, and there's people that can do it for 25 years. And I really try to remind myself that when people come in and they're new, whether it's case management or CRS or therapists, this is it for me, but it might not be it for everyone else. And I don't want to continue their injury, continue that path for them, because that's not going to be good for them, their family, their clients. And sometimes I think we just have to accept not everybody can do this. Not everyone can be a CO for 20 years, you know?
No, and I think something that, as you were talking, and I think you mentioned it as well, like I've had supervisees over the years that went on to have great therapeutic careers in a different context, in a non-community mental health context, in a non-problematic sexual behavior context, in a non-family-based context, in a non-addictions context, or FR, like the work we do, the roles we carry are heavy roles, and they're not going to be for everyone. And you might not be able to find the light in the dark. Like not everyone can find the light in the darkness. And I remember talking to one of my supervisees a couple years ago now, and she was actually choosing to lead the field. And it was tough because I just supervised her for clinical licensure. And I was like, man, but like you're licensed to like try that out first. And she's like, nope, I'm going to be a wedding planner. And that's what she did. But in the moment, talk about
that
darkness. I don't know.
Absolutely not.
But exactly, it's not for everyone. But I remember her coming to me and saying, Kim, the floor is falling out of the mental health profession. And I was like, yeah, I know. And then she said, and you're like the band on the Titanic playing as it goes down. And I said, but do you see the beauty in the music? Like, can you see, like, maybe I like to think I'm a lifeboat. All right, all right. I like to think
not that bad either.
I'm the lifeboat. But if I'm the musician, I can get down with that metaphor.
That's how he was dealing with the anxiety of the pending doom.
Yeah.
His music.
So if I'm playing as we're going down, I'm gonna play as we go down, and like I hope you'll dance with me. But she's like, no, I'm gonna go be a wedding planner. So I think that there's also. Like within our profession, I think we also need to honor, and I think that brings me to our last call, which is this sort of us versus them mentality within the helping professions, this scarcity mindset, so that as everyone, as the acuity increases, as the trauma increases, as the fear and the concern go up, I think we get tighter and we start holding on to things more tightly that might not be ours to carry. We start pointing fingers or casting blame. We play a nice little game of like hot potato, not it. I've been in so many like ISPT meetings or like treatment team meetings where we're like, hey, we've got this really high risk client. And like if we all lean in, we might be able to keep them off the floor. And then 3 people say like, not it. It's like, damn it, we need us all. No, okay, you're leaning out. Well, then I'm going to lean out. And then it becomes this like pointing fingers, this or that. And I think that that extends far beyond community mental health. I see it within the helping professions. I've made fun of my own friends who have been here for a season and then they go on into like nice, cushy private practice jobs. And I'm like, oh yeah, look at you doing the Lord's work. No, I'm just kidding. Private practice is great. There's a lot of people. But then I have folks in private practice say, well, shame on you, community mental health, for burning out the... It's like, man, like what? Come on. Can we all have just a little bit more space and grace for one another? And I say that, I know that I've been really frustrated at times with like our auditors or our MCOs or the legislators or the licensing bodies that pay attention to the work that we do to make sure we're providing a standard of excellence. And there are times when they show up and they, have a funny way of taking a bad situation and just making it 1,000 times worse. Like if you have the unfortunate event in which a client dies by suicide and the next day an auditor is knocking on your door, and usually not with that same level of compassion as you might be hoping for in those moments. So I guess from my last call, I'd like to just kind of challenge everybody within the helping professions to give everyone a little bit more room. It's not easy for anyone, even those of you who go into private practice. It's not easy for anyone. And so like affording that space and grace and showing that kindness to one another, even if you're a licensing body, even if you're an auditor, I think that we need to reach a point where we're intentionally looking for the good in the other versus like nitpicking and trying to find the flaws. Because I think our profession's kind of gotten too far that direction. And so I'd love to see us come back. So before we wrap, is there anything left unsaid? Are there any other bits and pieces, ways in which we can heal our profession while still serving our clients and communities?
I mean, I think things like this, like having conversations around the table, really keep issues prevalent, you know, keeps us aware. I feel like just more conversations about this, or given the opportunity to talk about these things, like I've been dying to have conversations with managed care companies. Like I want them to talk to a direct care staff who has to not be behind a desk and, you know, do what you do. And I respect their job, you know what I mean?
For sure, I don't want it.
Yeah, I definitely don't. But
like if you're hiring a consultant, my phone number it now.
But like more conversations with that, like the higher ups with the bottom of the totem pole, if you want to say it that way. But I think that would lead to more solving of problems. And more of the awareness part too. I always say if you're at the top of the totem pole, do the bottom totem pole job for a little bit, or like have some compassion or grace with the people at the bottom who are doing the direct care work too. But that's like the short answer. I think having more conversations with more people in the room about these things, I think would go a longer way than just you stay in your office, I stay in mine, and you know everyone does their own little things. I think it doesn't connect us. It really doesn't. So yeah.
That's what we were kind of talking about at the beginning, was just support. And you know, who knows more what we go through than us. So I think us all leaning into each other and talking about that, whether it's treatment team, whether it's, you know, bigger forums, whether it's this, you know, just being able to know that we can come to the table with that and have that the communication, I think, is just so important. Because, you know, whether it's about client death or about burnout, you know, maybe those are conversations we're not having when we're trying to train someone how to do an intake, like we were talking about earlier. But it's so vital. It's important because it's what we do. And that communication, I think leaving that door open all the time is so important. Creating that safety in being able to speak up about concerns. And
it connects us. And
yes.
If you have a connection, it goes beyond. So leaving those connections there.
Yeah, and that I think sometimes, you know, the comparing out, we can highlight the differences between our objectives or values.
Yes.
And there is a space where we're aligned too, ultimately, you know. So trying to find and spend more time there in the middle ground. And the other thing I was thinking is just on resilience. It's like both of those things where I think advocating, being assertive, being persistent, or pesky was maybe the term that you used earlier.
I think pesky's probably using it lightly, but I like pesky, right?
Yeah. Being persistently pesky. And I think there is that. And, you know, being realistic, that takes time, right? Yeah. So also, in the meantime, we need things have to happen right now with folks. So I'd just like to highlight, I mean, I think COVID was what a perfect example of that, where during times where there is scarcity or solutions look like there is no light in the darkness, it's like, what in the world do we even do? It's been remarkable to see how people have risen above that. And in counties that we serve where resources, even pre-2020, did not exist, right? Access is nothing, right? Levels of care. What levels of care? No, there is a level of care. There is a one provider for the whole county. And I think sometimes in those moments of scarcity is where we see the most creativity amongst our teams too, of, you know, we can't get that person into rehab, but what can we access in the community that could provide some of what they need, right? So I think it's both those things of persisting here to change and also getting creative with what we have right now, because the needs are not 5 years down the road, right? It's right now.
Yeah.
And looking for people's strength. And that's where resilience really, I think, is found in moments like this, when the floor is already done dropped out, right? So it's like we're playing on the band. Also, I want to keep hope alive. I mean, we know how the Titanic ended, but like, I'm looking for.
I never watched the movie.
Exactly. So how do we turn this ship around, right? Is there a way when it all does feel hopeless sometimes? But I think, you do it one little thing at a time, just like we've talked about.
When it's too big, we slice it thinner.
We slice it thinner. Yeah. So that's.
I love that. If you guys don't know, I'm going to shout out Kim. Kim's working on getting Family Based Our Own Training Center through PCS. And I'm not on that side of things, but it gives me hope, because then we hear about it, how you've been trying to advocate and be, if you want to call it pesky, whatever it is.
I'm sure they'd call it something different, but yeah.
But to me, like kind of what I was saying earlier, that means, the higher ups are listening, they're hearing it, they're sitting at these conversations around the table. And, I don't necessarily believe I have a voice with the MCO to do something like that with the insurance companies, but you do, So bringing that in and then hearing that, I'm like, they're listening. Like they're listening, and whether it happens or not, knowing that you've advocated for our own training center, things that we've needed for a while, being here for a while. I know we need our own training center. You know that too. So I don't know, that gives me hope too. Like staying here, because I'm like, you're listening, someone's listening. So I like that. Like continuing to push to get these regulations changed, all these things. Keep going.
Yeah, and sometimes it's you did some advocacy for a documentation for one little. I mean, it feels like a big program, but really it's a small program within another outpatient clinic. But that means something to those folks who the day-to-day grind of it is, that's what wears us down, right? I see the passion for the work they're doing with the clients, right? But that wears us down. And so just to say, you know what, I don't know if anything is going to happen with this, but I'm going to try.
I'm not as confident anymore, Crystal. I hate to tell you. Training center, it's not an if, it's a when.
Yeah.
I'm not giving up. And a number, but that's how I heal the moral injury, right?
Yeah.
Like I see the problem,
Exactly.
and I have a certain level of like power and privilege, and I won't shut the fuck up. I think that
Love that.
because also I know that I'm not as young as I used to be, but I've still got some time in this field, and if nothing else, I'm gonna wait you out.
Right.
One of my favorite quotes is a Albert Einstein quote, and it's that I'm not smarter than anybody else, but I will stick with a problem longer. And I think that's what it takes sometimes. And so I think that's really where now the documentation. Crystal, I don't know, but I tried. Win some, you lose some.
And
but
what we've done is creatively, we've done some other things, to help alleviate the pressure there. So just to know, though, that people that goes such a long way, and that's what builds the trust and the relationship, to know you not only you came down and watched me do it. So I feel seen, and that goes a long way.
Yeah,
That's
and
it
heard.
too,
And
Yeah,
absolutely.
our training center that we have now, they've made changes though, because they know we're trying to go for our own training center.
Yeah.
So, and we haven't started training yet this year. It'll be next week, I think. But it already is better than last year, and hasn't even started yet, just because of what they're starting to implement now, because they know we're trying to go for our own to meet all of our needs,
and my goal is to hit that 100% of what we're looking for, right? But if we fall short,
it's already better,
like at
though.
least we made some change along the way, and my hope is that
Exactly.
that serves those who are serving the clients.
Exactly.
And I just think, like, even if we say, okay, we have this idea, can it happen? And it's like, no, but this can happen. Like, it does so much to know that at least there was advocacy on our behalf. Because we're advocating on the client's behalf, or we're advocating on, other things that are happening. And so it's just nice to know that that's still important. Like, it doesn't matter. Like, it's still, the value is still people. Like, no matter what, like, that's still what it is. We want to serve the communities we serve in the best way possible. And, like, that, knowing that I am within a company that is always the priority, I think that's what helps that resiliency, too. Because I feel very overwhelmed sometimes in the community that I serve. I'm only one person.
Yeah.
But I know if I've got a bunch of other clinicians and, people that I work with and teams, all doing the same thing in different areas or within the same community, it's just like, okay, I'm not in this by myself. Mm-hmm. Like, there are people doing the same thing for the same reasons, and we're going to figure something out, even if it's one person at a time.
Man, but we will, right?
Yeah.
Like, that's the thing. Like, we'll figure it out, because at the end of the day, I think we're on the right side of the story. Maybe not always perfectly, maybe in a messy way, maybe in a pesky way. But I think, like, at the end of the day, like, people are valuable, and that's what drives us forward. I think that's why you keep doing what you're doing. That's why you keep showing up. Yeah. And at least from my perspective, I know that we might not get that 100% better, but to your point, I think you said, like, the rungs of success sometimes need to be pretty close together. But if we can make it 5% better, 10% better, 20% better, man, sometimes that's where the power is. And the trickle down of that. Like, if our clinicians feel supported, and our clinicians, maybe we could reduce their paperwork by like 20%, because like we're advocating for a lot of different things. But we go back and we say, listen, like, how do you document a smile?
Yeah, right.
How do you document that therapeutic growth to say, like, this person hasn't looked anyone in the eye for 15 years, and today they looked at you?
It was a notable affective.
You know how to document it. Look at you there. But
you don't capture that.
It gets pushed over in an audit and no one cares.
I know.
Well, and you know what? I will share that I was thinking of this on my way up, because I sat in an audit. So, and this is, again, I think the middle ground piece of it, where this was many years ago, but I sat in an audit with a funding source, a county funding source, and he said it was the most complimentary thing ever to be said in an audit, I think. And he said, your notes really, not mine, but the program's notes really, they capture the progress on the treatment plan goals and all of this. And he said, but you know what it also captures is the story of the person. And I thought, holy moly. And he was almost tearing up, honestly. And I thought, that is really, so they are oftentimes serving the same goal, right? What that looks like. Sometimes the objectives are a little bit different, efficiency and all that. But it's like, we captured the story. Sometimes you can do that, but I got goosies when the person's mad at me. You don't write that in a chart. You put that in your reflections for your FITS email. That's where you put it, and you keep it here. Yeah.
I just want to thank you all for coming together and leading such like an inspiring and powerful conversation. And for what each of you do in the day-to-day, because I know that the work isn't easy. I know that the burden is heavy, but I also think the impact is beyond measure. So thank you so much. Thank you all for listening to the How to Be Happy Hour. We will be back in a couple of weeks. I think we're focusing on pets next. So we're going from like a really heavy topic, and we're going to make it a bit lighter.
Are you bringing them in here? Because then I'm going to
I was going to say, we'll be back in a couple of weeks.
appearance if that's the case.
That's also what you do to help us.
I mean,
Yes.
this isn't like a therapy building, though, so like you could, right?
We
That
could
brings
bring all the
resiliency
dogs.
too.
Yeah.
That's what
My
I'm
dogs
saying.
recharge me every day.
Yes.
Even though they're a pain in my ass every day.
Yeah, I fight with my dog on a daily basis.
Oh, yeah, same.
She's like a giant 95-pound toddler.
Well, thank you all.